What I do as a worksite wellness consultant is I help our members create worksite wellness programs. And basically, what that is bringing a culture of wellness to your workplace. So if that is something you want to do, I'm here to help you. So you know my background. I've been with MESSA for over 20 years. I'm a registered nurse. I've been a registered nurse for over 30 years, and I have additional coursework and certifications in fitness, nutrition, wellness, and chronic disease. So I contribute my skills and learning to helping worksite wellness teams and committees get started. And from the time I started this position until now, there's so many more people, so many more worksite developing into places of wellness. Let me check the chat real quick before I get going, because I want to see who in here um, actually has something going or wants something going. First time, first time, first time. Great job. So when seeds are planted, they grow roots. Once these roots take hold, a small plant will begin to emerge and eventually break through to the soil. And that is how the understanding of gardening is. And I just recently took a botany class for plants. And one of the assignments was that I had to plant seeds from the beginning. A couple months ago in my garage, I had to get all this stuff, a warming mat. I had to get lights. You have to do certain things with seeds, different types of seeds. Some seeds you have to put in the refrigerator. Some seeds you have to keep in water. Some seeds you have to, they call it stratify or scarify, scrape them, and you plant the seeds. And there's different seeds that have different purposes. And it's so much analogy to building a worksite wellness program. But to make a long story short, at the end of this project, after I put all this together in my garage and planted these seeds, the next assignment was supposed to be, replant what grew. Well, nothing grew. I didn't get anything, right? So right now I have in my garage these pots with dirt. I had these different things for composting and the dirt, and nothing grew. And I was so frustrated. And it kind of spoke to me about planting seeds. You need patience. If you're working with a worksite wellness team, or you are the primary person leading a worksite wellness effort, I want you to remember you're planting seeds and you might not see growth right away, but you have to stay patient, right? Today, we're going to talk about a lot of different things, and we're going to plant some seeds in you. And this might be for your personal wellness. You might be here to hear some things to get your personal wellness journey going, or for a worksite wellness space that you are developing. If nothing else, once you get started, remember to be patient. If you get one or two people to come to your activity or to fill out a survey, you are still creating a garden. You are still moving forward. So today I want to tell you about your MESSA benefits. I want to tell you about some worksite wellness resources, and I want to tell you about some activities for your group that you can create. For some of you, this may be repeat information, but it's always good to hear, to iterate it over and over again. For others, this is brand new information. So as far as our MESSA members go, and this is for you and your colleagues, and this can be a part of your worksite wellness program, incorporating what MESSA benefits are offered to our members. Remember, we have access to support. We have a member service center that has received awards for their customer service. Always available to talk to you one-on-one if you have a question. You can access them. Our MESSA field representatives, and we have a few in the house, they are local. So if you have a question about your MESSA benefit, you may have met your MESSA field rep before, but I just wanted you to see their faces and where they are located throughout Michigan. Teledoc, if you haven't heard of Teledoc, this is our virtual healthcare platform. So if you live in a rural area and you have limited access to healthcare providers, Teledoc may be an option for you. If you, let's say you or a family member develops a illness and you need to go to an urgent care or perhaps not an emergency room level type of issue, you can use our Teledoc option. With Teledoc, you need to register first. Once you register, you have access to 24/7 care, and that includes mental health as well as chronic condition management programs. Programs like diabetes prevention, diabetes management, hypertension, and weight loss. They're all accessible through our Teledoc Health program. Again, you just need to register. You can go to MESSA.org to find the link to Teledoc. Anybody in the house doing Teledoc? Put it in the chat for me if you are. And the weight management option that just started in January. So that's replacing Omada. It's a great program. It incorporates a support program as well as education, and it's basically lifestyle. It's not a diet. I just need to check these chats. Let's see. Great, great, great. Great, you're working with the weight management program. Good to hear that. Urgent care, weight management, excellent. Hinge Health. We brought Hinge Health on in 2025 January, and actually they'll be here today. And I'm using Hinge Health, virtual physical therapy. I can remember about 5, 6 years ago, maybe longer, when we were really doing more virtual urgent care type services. And I used to think, wow, I wish they could do physical therapy virtually. And now we have it. And what you do is you register, you go to MESSA.org. There's a link there to register, and they may be putting the links in the chat if you're interested. And once you register, you download the app. You fill out the assessment, and what'll happen is you'll have a health coach assigned to you, as well as a doctor of physical therapy. And based on your issue, they create a program specifically for you. And the health coach works with you as you develop behaviors that will support your healing and recovery. So I've been doing it for about 3 weeks for a hamstring issue, and I'm really pleased. So I determine how many sessions I do. I determine a week. So when I do what I'm supposed to do, I get a prize. And I'm not going to tell you too much about it because Hinge Health will be here and they're going to talk about what they do and what they offer. Medical case management. This was the first assignment I had with MESSA back in 2003. My first mission as a medical case management nurse, one of the best medical case management programs that exist in healthcare, and I'm not biased. We have nurses here at our headquarters that are bachelor's prepared, as well as additional coursework in chronic disease and complex conditions. They manage cases, and what they do is they assign our members that are in catastrophic situations, they will assign a case management nurse that's in their area to help handle the case. So let's say you are in Lenawee County, and you have what is considered a catastrophic situation. What is catastrophic, Rhonda? It is a situation where you have a medical condition and you require multiple providers, perhaps multiple specialties, multiple medications, and perhaps high-priced or specialized medications. And it would be considered confusing, highly technical, and perhaps even a burden for the caregiver. So once we find out about it and you decide you want medical case management, we offer the case manager in your area. And what the case manager does is they help with doctor's appointments, they help arrange physical therapy appointments if they're needed, and they can even attend appointments if necessary. And they work with the case manager that's here at headquarters to manage your case. Phenomenal benefit. Definitely something that you want to put in your worksite wellness program, even if you're just putting flyers in the break room, or perhaps flyers in their mailboxes, or attaching a flyer to a newsletter so our members will know about this benefit. We don't do commercials. You won't see it on the billboard. So it's important, I think, sometimes, if for those of you who have decided to create a worksite wellness program and offer different things to your colleagues, for them to know about these wellness benefits that we have, that they have. Second MD, of course, you can get a second opinion with your MESA, but this is just the extra, we go extra above what is asked for. Another way to get a second opinion on complex health issues. This is part of your MESA for you and your dependents. Ovia Health, another one of our wellness benefits, and it provides support to families, to women in all stages of life. So if you are seeking pregnancy, conception, and in the past it has been difficult, or you're in a situation where you foresee it being complicated, Ovia Health can help and provide support as well as information. If you need access or providers identified, Ovia Health can help. If you are in that midlife stage they call menopause, Ovia can help. They provide coaching information for pregnancy. For each trimester, there's certain information that every woman should know, and Ovia has that type of information. So this again is free for our members and their dependents. Information that you don't have to go out on the internet and find. Of course, you want to seek out information from your OB-GYN, but we're here just to support and be a part of the team. That's why we provide these benefits. Mental health. We provide mental health benefits. There is no disparity between mental health and physical health. And if you didn't already know it, school employees, the stress in this industry is equal to stress or chronic stress in the industry of firefighting and police officers. And we know chronic stress is a precursor to mental health problems. So accessing your mental health benefit is very, very important. And your colleagues knowing what is available to them is very important. For example, My Stress Tools. We've been working with My Stress Tools probably for the last 3 or 4 years. This is a wonderful platform with several different tools to help us not only learn about stress management, but also interactive opportunities. You log on to My Stress Tools through your My MESA account. If you're on your PC, it's on the top to the right. You'll see wellness resources. You click on wellness resources, and the options you'll get is the health risk assessment and My Stress Tools. Click on My Stress Tools. It'll take you to their website. If you go to My Stress Tools website without going through My MESA, you won't be able to log in. And your name will pop up. It'll say, "Hi, Sarah. Hi, Tara." And you'll know you're on their site, and you'll see a suite of different activities. You'll learn about journaling and how journaling can help with chronic stress. You will learn about mindfulness. There's a mindfulness coach. There is a diet coach. You learn about the different things needed to help us sleep. So a plethora of wellness information. Now you can use this for your benefit, but as a wellness leader, a wellness liaison, you can use it for your coworkers and colleagues, even if they don't have MESA. What I tell people is, just like we're doing this today, I could log into My Stress Tools. I can bring it up on the screen if I had a meeting going on or some type of activity, and we could do the mindfulness coach, or we could go through one of the visualization activities. So you can use it for the whole group, even if they don't have access to it because they don't have MESA. So we feel like wellness is all inclusive, even if everybody in the house doesn't have MESA, they still can get the benefits of it because you do. Wow, I thank you. Oh, you like my stress tools. I do too. Good to hear that. Able to. Um, is another program for mental health. It's different from visiting your therapist for a session. You work with a session, a therapist, excuse me, and an 8-week program is created. It's almost like seeing a health coach or a personal trainer. And they create a program for you that's all encompassing because mental health is connected to your physical health, which is connected to your lifestyle and your behaviors. So they create a whole program focused on your goals, and you meet with your therapist on the phone or video. This is a great program. I'd like to see more people access this. And to be clear, you're still working with a licensed therapist, but they are operating like a coach, and you're in an 8-week program. And this is a benefit for you, and your dependents. Nurse line. Everybody has a nurse line, but we still have ours, right? So if you have questions, medication questions, or questions about an illness, whether you should go to the ER or not, you can still access the nurse line anytime. And remember, we're on Facebook, Instagram, social media, and our MESSA app, okay? And you can get to the My Stress Tools on your app, okay? So let's talk about planning your worksite wellness program. We have a health risk assessment. You should be interested, a health interest survey, and wellness report card. I'm going to talk about these 3 tools you can use. And you may have used them already to start your wellness program. Now, I tell people about the tools to use because this is a way to customize worksite wellness. If you want to be real specific about addressing concerns. But this is the thing. We already know most adults are stressed. Most working adults are stressed. If you just started your wellness program with the activity that you're moving more, or you started your wellness program just disseminating information, right? Or you just started your wellness program sharing recipes, you are still addressing all the issues, right? So for people that want to get off this platform at 2 o'clock and start something on Monday, if you simply send a flyer on Ovia Health, you have a wellness program, right? What I usually tell people to do is this is the time to start meeting to plan for September when school starts. So right now you should be writing down ideas on what you want to do for September. So surveying your audience. If your school district is all MESA, you could do a health risk assessment. This is a tool you have access through your My MESA account. And what it is for as the program planner, you could do a campaign and encourage all your members to take the assessment. And what it does is it tells them, not you, it's for them, or it's for you personally if you take it. It tells your health risk. It helps you identify how your lifestyle right now is leading you towards certain risks, okay? Like diabetes, high blood pressure, and certain types of cancers. So in the world of health promotion and behavior change, this tool is the wake-up call. This tool puts people on their wellness journey, and it causes them to be more self-aware and self-discerning, right? Now I know I'm not walking enough. Now I know I'm not eating enough vegetables. Now I know I'm sitting too much. So it's the wake-up call. So for you as the program planner, it's timely because you are sending out the email now about what you plan to do with your wellness program and its mission. And at the same time, they're getting a wake up that they need to do something, right? Second, as the program planner, you can request a report. It's a de-identified report, gives no one's name. It doesn't specify anybody, but it's aggregate. So it'll tell you the group that you are targeting is at risk for heart disease or at risk for diabetes, or they are sedentary. It gives you a percentage. So for a wellness team, wellness committee, wellness liaison, this helps you not to waste time on creating activities that are unnecessary, or it helps you target the issues. So knowing this information, I know my people are at risk for diabetes. I'm going to get a nurse in here or someone that is trained in diabetes education, and I'm going to have them talk about risk factors. I'm going to do a walk because I know exercise helps decrease risk factors for diabetes. So it helps with planning. Health interest survey, this takes it to another angle. So this is for everybody, even if you don't have MESSA, all your colleagues, your members, you're finding out what they want to do. So you know exactly what you want to plan. You're not wasting your time in that hour wellness team meeting. You know exactly what people want to do. You're not going to plan something that they don't want to do. And just like I did at the beginning, you can use a health interest survey to find out what types of skills you have in your workspace. You might have a yoga instructor, Pilates instructor. We got a bunch of Zumba instructors. So we know we can do a Zumba class. We'll find out what time they want to do it, where they want to do it. You might have personal trainers. And often with those types of certifications or skills, like most yoga instructors have to get so many hours to go another level. So they're looking for opportunities to contribute their skills for free. Most Zumba instructors just love to dance. So we'll just do it. You find us a space, give us a time and bring people, and we'll do a Zumba class. And you probably have the same situation, a mindfulness coach that wants to do mindfulness on breaks. You have those types of talents already in your workspace, and you can identify it with a health interest survey. Wellness report card. Again, this is specific for MESSA people, MESSA members, okay? And it's another way to target, zero in on the issues. And this is especially helpful if your worksite wellness assignment was given by the superintendent or the chief financial officer, and they're looking to quantify things. It's hard to quantify wellness. So this is kind of a way to do it. It's basically helping you know what your membership is doing with their health care, how they're utilizing health care, right? So it can help you redirect members that might be using the ER for things that could be done in urgent care, or at least educate the population. So it'll tell me who, not specifically that person, but what percentage of people are getting physicals or getting their wellness exams or going to the urgent care. So it directs education opportunities. If I find that less than 30% of our population are getting annual wellness visits, perhaps we need to do some education on wellness visits. So some things you could do. If you need just some brain stimulation, go download the Worksite Wellness Toolkit on our website, and that can help, okay? Contact me. I love to support. I love to sit with wellness committees and give ideas. A wellness activity calendar is there. So you don't have to recreate the wheel. You can use this as the wellness committee to help plan activities throughout the year. And what I suggest too is go to the CDC or another government, health.gov type of website, and download the calendar for the year and find out what health theme is being addressed for each month. Like I said, May is women's health. It's also mental health awareness. So many organizations will have tools that you can use. You don't have to recreate the wheel. They'll even have verbiage. If you want to send out a newsletter, if you want to send out email tips, they have verbiage that you can use already. So don't recreate the wheel. Don't work more than you have to. You're already working very hard. Mindfulness, movement, nutrition. That is the principles you can use to create activities, or just to think about it, put it in a kind of a framework, because they all address chronic stress. And let me repeat, chronic stress is usually the root cause of most health conditions. That migraine, or it can help most health conditions, right? You might need a little medication and some meditation for a migraine. For movement, some stiffness, you might need to move more, drink water, and you can create activities where you give your members an opportunity to engage in those activities, or those behaviors during the workday. That's what worksite wellness is. Dissemination of information. Once they get the information, that's when the wheels start turning and people are, they get in those stages: contemplation, preparation, and then they go into action. So you start with the information and they start thinking about it. Then when they see other people doing it, eventually they'll do it. Some things you can do. I'm ahead of time, right? Am I moving fast? 10 more minutes? Oh, okay. So mindfulness. Some things you can do. And if you didn't already know, we have a mindfulness coach in here. Mindfulness is basically, it's nothing mystical. It is a contemporary term for meditation. And groups of people have been doing meditation for thousands of years. And there's so much science to support the benefits of mindfulness. There's science to support mindfulness for depression, mindfulness for anxiety, mindfulness for weight management, mindfulness for blood sugar management, mindfulness to help lower blood pressure. There's so many papers out there. It's proven. So incorporating that in the worksite wellness program, if that's all you did, you would be doing a lot for yourself and for your members. And it's simple as practicing the moment, slowing down and practicing the moment. We're all moving so fast and doing so many things. And often we find ourselves, at least our thoughts. I'm right here, but often my thoughts are a day ahead, already in the Saturday, or at least the end of the day, or behind me, what happened yesterday. And those thoughts, especially when connected to a negative emotion like anxiety about the future or fear or shame about the past, those are stressors. That's chronic stress. And that puts my brain in a survival mode status. And it causes so much metabolic and chemical dysregulation that it can lead to disease in my body. A lot of those symptoms or things we feel throughout the day, the headache, the backache, the twinge here, the irritability, can just be related to lack of mindfulness. So helping your colleagues understand that and perhaps practice that throughout the workday can be helpful. So some different things you can do for mindfulness. Journaling. And remember our My Stress tools. If you need practice or you need to understand mindfulness, check out My Stress tools. And there's a 28-day mindfulness coach where you go through a 2-minute video for 28 days and it teaches you mindfulness. So let's say you want to start something like that at your workspace. You can send them to that mindfulness coach. And let's say you all agree once a week on Monday, we're going to go watch this video in the My Stress tools. And we're going to share about it at lunch or during some after school thing or association meeting. So you're engaging people into mindfulness and doing it as a group. And some people can do things by themselves, but often when motivation is low, that group think works it works a lot better when people know their colleagues are doing it, or when there's a group of you doing it. It provides motivation and it helps people stay in it and be consistent. Mindful Monday email messages. Again, you can use My Stress tools, use the articles or the information in there and put it in an email, a short email. You don't want to do anything long on Mondays. Call it Mindful Monday. You could do it once a month. And just give them credit from My Stress tools and educate your population about mindfulness. Incorporating a gratitude activity. And if I've been at your school for lunch, I talk about this all the time. Wellness pros, Winnie, I'm always talking about gratitude and appreciation, and it does work. I know it works because it works for me. I try to be grateful. And it's not, I always say, it's not putting rose-colored glasses on and ignoring issues, but it's deciding to protect your health and pursue your wellness journey, protect your progress towards your goals. Because there's things that happen in your body when you practice gratitude. Chemically, there's some things, because there's some things that happen in your body when you do the opposite. So just deciding to appreciate or things that are worthy of appreciation can change the chemical milieu in your brain, right? More serotonin, more dopamine, lower cortisol. And there is research on that. You can go out and check it out. Works well for adolescents, for children, but it works for adults. And it takes practice. And I was at a school at Warren Con, and I can't remember the name of the school, just last week. And we did a lunch and learn. The lunch and learn was on menopause, but I noticed the wall, and this is Warren Con, the Warren Education Association has wellness officers. Now, this is an idea. Tell your association to create a role. Bob did this at Warren Education Association, create a position called the wellness officer. So Melissa, she's on the platform. She's one of the wellness officers. But the school I was at, they had a wall in the break room that just had notes from different teachers, different employees, and they were saying who they appreciate or what it was a thankfulness board. I took a picture of it. I meant to put it in this so people could see it. But those types of things, I know when I looked at it, I felt like my serotonin lifted, my cortisol went down because I was just reading all the things that people were sharing about each other and just their personal life, what they are grateful for. And believe me, this is a time in life where people need to hear good things, right? You're lifting up your colleague, your coworker, because I guarantee you, everybody walks through the doors of the school building with a burden. Something happened on the way to work, something's happening at home that's burdening them, right? And just them seeing that board, sometimes it's hard to tell people things to their face, but just seeing the board and seeing that somebody appreciates you can lift them up. And this is key too. When you practice appreciation and you tell somebody you appreciate them, you're helping them on their wellness journey because you're helping them lower their cortisol. You're helping them lower their stress hormone. And we all need that in the workspace, right? On My Stress Tools, there is a 30-day resilience challenge. You can do that as a group. Build up your resilience mentally, and it helps you physically. Also, consider some mindfulness meditation sessions. We have a meditation coach right here on the platform. So you probably have some at the school. So consider that at lunchtime, during breaks, perhaps a day of the week that you get people to come. Let's just sit. We used to do that here at headquarters a couple years ago. We sit in a room and just be quiet. Just quietness. Movement. We all need to move more. I don't need to do a survey to find that out. I could just tell you, right? We sit too much, and I have some elementary school people here. I know you're moving a lot, but we need to move in a way that is non-stressful as well. But movement is a necessary thing. It helps us lower our risk factors for diabetes. It helps increase and circulate our circulation to the brain so we can think better. It minimizes that brain fog when we have more circulation to the brain. And I always learn in nursing school, I always say this, my first semester, if you don't use it, you're going to lose it. I know the longer I sit, I get stiff. I'm at that age where it's hard to stand up without feeling a little stiffness. So we all need to move around. And so especially those of you who work in a space where you're sitting a lot, you might consider adding some of these activities, a walk or step challenge. And we do have access to an online walking platform, and that's first come, first serve. But yes, we do have that. Also, there's free walking platforms out there on the internet that are specially designed for workspaces, for people at work, so you can do individual and group type of work challenges. So just some different things you can do. Ladies, everybody in here needs to be doing strength training. I believe Dr. Bittner is going to tell us more about it, but we all need to be building bone, our bone density. We're losing it as our hormones decline. And this, I'm not just talking about people like me. I'm 57. I'm talking to you if you're 35, if you're 32, if you're 25. We need to be building bone, okay? Because osteoporosis, osteopenia are serious things. And as our hormones decline, so does our bone density. So definitely movement challenges. This helps reduce our risk factors for high blood pressure, diabetes, all those chronic illnesses, and some cancers. push-up and plank challenges. Now, I put down things that are doable because we did them. We did a plank challenge and we did it on Zoom. I know groups that are doing push-up challenges, flexibility challenges. I had a group doing, you might be here, I don't know, do a sleep challenge. So those are possible in the workspace, okay? Group exercise during the lunchtime. Create a fitness directory. We did this, and what we did is we polled our members. We asked them to send us their favorite exercise studio person YouTube video. So we created a directory, and we know it is individuals that are preferred by us. So we feel like that's a good reference. And on-demand fitness. Let me tell you, if you're a MESSA member, you have access to Blue 365. Go to Blue 365 register, and you have access to on-demand fitness challenges and fitness opportunities like Pilates, yoga, stretching, strength training. Also, you have access to a membership, gym membership. If you want to take this to the gym, now you should tell your members this. You can get a gym membership for $19, unlimited visits to several gyms in your area. Like, I'm a member because of Blues 365. I'm a member to 5 different gyms in this area, and I can go to all of them, unlimited, right? You go into Blue 365, go into the fitness facility area, put your zip code in, and it'll show you what facilities you can go to for $19.99, what facilities you can go to for $29. It goes all the way up. And even when you travel, you go in there, put the zip code where you're traveling, and you can go to gyms in those areas because you're paying for it. Just one payment a month. So check that out. Make sure your members know that, because I get emails, people saying, do we get any gym discounts? Yes, you can get a gym discount. So that is it. Nutrition, we all need to be eating better. So you don't need a survey to know that. Different things you can do for nutrition. And again, there are nutrition articles and information. It's a diet and nutrition coach in My Stress Tools that is available for you. Things we've done in the Wellness Committee here, recipe exchanges that ended up being a recipe book that's in our archive. Newsletter. If you get Discover You, there's always, I want to say most of the time, there's a healthy recipe. You can do the same thing. You could use that recipe in your association wellness newsletter if you just want to target your association. If you're in an office, a department, a small department, you can exchange recipes with each other or consider a salad jar luncheon. Now, based on a first come, first serve basis, I love coming out and doing lunch and learns with our members. I talk about a topic, MESSA wellness, fitness, nutrition. We did menopause a couple weeks ago, sleep. So if you want to host a lunch and learn, invite me out. We'll talk about MESSA or whatever topic, health theme that interests you. I'll bring a healthy lunch. We'll have fun and learn some things. And what Worksite Wellness does, if nothing else, is providing social connection, causing that community feel to flourish, right? So often we feel disconnected and isolated. Worksite Wellness brings everyone together. And you know what I find, school employees love competition. So when you're doing these walking challenges and different things, they love that kind of stuff. And as it gets warmer, getting outside, perhaps getting in a marathon for a good cause is helpful, a good way to motivate people to move and get together. And there's so many different types of wellness programs. It can be just exclusive to your work colleagues, or you can do things that brings the family together in the evening. The association might want to consider something like that, or a health fair for the community where you have different vendors at your school and people come in and you're giving the vendors an opportunity to expose their service, and people come and they find out and you share wellness things. So being engaged in this way, just wellness brings that. And there is a health and wellness benefit to social connection. So Join me. There's one more Wellness Pro session this month, every third Wednesday of the month. So May is the last one for this school year. We'll be starting back up in October. We meet every Wednesday at 7 a.m. and 4 p.m. and we talk wellness. There is a topic on the schedule, but we can go off topic if you have questions, if you need ideas. Winnie is here. She's one of our wellness pros. She's always there each session. It's not mandatory. If you're just dropping in with the question, I'm just here for you. I'm definitely 7 a.m. to 4 p.m. every third Wednesday. Also, you can reach me, rjones@mesa.org or healthy@mesa.org. If you want me to come out and sit with your wellness team, if you want to jump on a Zoom meeting, if you're interested in a lunch and learn, if you want to add a wellness or health theme to an association meeting or a professional development day, reach out to me, and we definitely can do something like that. We can start planning for September, October as the school year ends. So again, healthy@mesa.org. You can reach